said. Yeah, so let's jump into them. Like, what in general, what are some of the top things you think people with, I mean, arthritis is an umbrella term for over 100 conditions, it just
Yes.
means joint inflammation, which can be caused by lots of different things. But, the purpose of this podcast is really more on the inflammatory arthritis side, but
Right.
there's like a Venn diagram that overlaps, right? Some of the things for joint protection for osteoarthritis are the same for
Right.
rheumatoid or psoriatic. But yeah, what are some of the things that you find are like kind of the greatest hits of ways people can take better care of their hands?
Well, one of the best things that you could do is get early treatment, right? And we can
Mhm,
say that all day until we're blue in the face, but again, the sense of urgency needs to be there.
mhm.
When you're red and inflamed and really painful, that's not necessarily the best time to get it because you're
Mhm.
red and inflamed.
Yeah.
But once as that starts to fade, then the best time to get therapy is right as that starts to fade out, because what you want to learn is what you need to do with the residual edema that's left.
Mhm. And what is edema? For
Edema is when you're swollen
Mm.
and you see like there's like sometimes the most common places it happens in the back of the wrist, on the back of the knuckles, and that's the swelling. That can be the puffiness that's there.
Mhm.
It can feel kind of soft and squishy, or it could
Mhm.
feel a little bit firmer and dense. Sometimes it
Mhm.
hurts, sometimes it doesn't. It really depends on the person, but the swelling that remains from a flare up can cause a lot of different problems uh, that cause tendon ruptures. So the tendons
Mm.
are in the back of your wrist, open your fingers, and
Mhm.
left ignored sometimes can rupture over time, like kind of deteriorate the tendon. And once they rupture, you can't open your fingers anymore. Once that
Yeah.
happens, you require surgery.
Mhm. And a lot of people
Sometimes
want to avoid surgery.
sometimes they won't. Yeah, I would imagine majority of people want to avoid surgery. And one of the reasons why you want to take care of certain things early, because you just don't have the luxury of waiting,
Mhm.
is that when you treat it early, your tendons have better, let's say, the tendons have, if you were to require surgery, the quality of your tendon can be
Mm.
better when you take care of something early versus waiting. I actually met a therapist who ignored all of the signs because,
Mhm.
we're all human, and when things happen, they don't feel good. We tend to ignore it and hopefully it goes away, because
Yep,
maybe at
yep.
some point in the past it has gone away. This time it
Right.
didn't go away and it ruptured the tendon. The surgery
Wow.
required from it, um, because the quality of the tendon was not good, it re-ruptured, requiring a second surgery. So there's certain things that if you find a trusted therapist that you can go to time and time again for different episodes, they can really help you to manage some of those symptoms, like the swelling. They can help you manage the loss of motion that you could have.
Mhm.
So, for example, with rheumatoid arthritis, most of the time, the therapist, the therapist, most of the time, the person doesn't have a problem bending the finger. It's that they can't open,
Mhm.
right?
Sorry,
It's
I'm
that
doing
they
it
can't
as you're doing it.
open. Yeah. So they can't open. So the fingers start to kind of lag down a little bit, not the
Yeah.
wrist, the fingers, at the big knuckle.
Oh, yeah.
So when you can open like that, yeah, you see. Um, so what happens is I always draw on my fingers when I teach, but we
Oh,
have
great.
we have these they're called collateral ligaments. They're ligaments in
Mhm.
between that give support to our big knuckles. And then
Mhm.
we have these tendons on the back of the hands that open up our big knuckle.
Mhm.
And when you have an episode and it erodes at the quality of the tissues of your big knuckle, your joints will start to fall. They'll fall
Mm.
down into the palm.
Mhm.
That's why you can't open as well. And they'll
Right.
also do what's called ulnar drifting. This is the ulnar side of
Yes.
your hand, and your fingers will start to drift. So we understand that with rheumatoid arthritis, there's a certain pattern that takes place, and it's a zigzag pattern. So your fingers go like this, then your metacarpals go like that and your wrist goes like that. So
yeah, and the ulnar side, for those listening to the audio, that's just the pinky side. That's what I call
that's
it.
that's the pinky side.
And the metacarpals are the knuckles. But yeah, we have the majority of people listening are patients, but we also have a lot of OTs listen too.
Yeah.
And,
so we tend to start seeing like a zigzag pattern in the fingers and in the wrist.
Mm-hmm.
And when it comes to splints and braces, they can do a wonderful job for certain phases and periods, but you want to be careful with wear time, schedule, how long you're wearing something for, because worn too long, just like with worn too long, you'll lose motion.
Yep.
Blocking certain things that don't need to be blocked will cause other issues. Solve one problem, create another one.
And that's, I think, something that's just striking me, again, trying to keep things on the basics for the listeners, especially maybe someone who's newly diagnosed. The hand is an extremely complex part of the body. And I'm going to post a link to this in the in the show notes. But one thing that I was really struck by in occupational therapy school learning about is that you have like a sensory and motor cortex on both sides. Sensory is like feeling stuff and motor is moving stuff. And the amount of space that's taken up by the human hand, as well as like the lips and tongue, right, with the homunculus, which is like a visual representation, it's huge. And isn't there 23 muscles that go into the hand or something like that? Like half of them are intrinsic, half of them are extrinsic, something in the mid 20s. Half of them originate beyond the hand, earlier up in the body, like the elbow-ish. I'm not a hand therapist, by the way.
So the intrinsic muscles are the muscles that start in the hand and end in the hand, and they're the ones that help you go like wah 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 like that. They can help you open your fingers right here. Their thumbs move, your fingers move. It allows you to have dexterity, meaning you can move things inside your hand. And you can use little things to pick things up. And then you have your extrinsic muscles that start outside of your hand, usually at your elbow, and they come into the hand. They're the ones that pull your tendons, your knuckles down, all the way down to make a full fist. They also help your thumb to come all the way down. They're the muscles that cross your wrist to get into your hand. So when we look at the hand, we always have to consider, what is the wrist doing?
Yeah. And that's why a lot of people get confused, because they'll say, well, let's say my pinky hurts or my ring finger and pinky hurt. Why is this therapist up here in my elbow? Well, because, why are they saying it's a wrist issue? It doesn't hurt in my wrist. It hurts in the fingers. Well, it could be because the nerves are being impinged somewhere higher up. And so same old soapbox, but it's extremely complex, and that the sensory cortex, also the part of your brain that's like, I need to process what things are feeling like, hot, cold, temperature, and that also has devoted a ton of space, more than the surface area you would expect. And that's why your hands, this is my explanation, but why can hands hurt so much when they're so small? It's because your brain pays a ton of attention to them, right?
It's because all your nerve endings are there.
And there's a ton of, I mean,
your nerve endings. If you don't have the nerves working correctly, you won't feel hot, cold. You won't feel when something is metal or plastic or rubber. You won't feel the density. You drop things out of your hands because the brain is no longer connected to the hand to say, hold that, squeeze it, because the information goes from the tips of your finger, from the nerves to your brain, and sent back to say, squeeze it a little bit harder because it's heavy. Squeeze it a little bit lighter because it's, don't need to kill it. You're gonna break that flower if you squeeze too hard. So there's a lot of feedback, goes very quickly. It's complex, but at the end of the day, the hand does everything for you in your everyday life. And it is probably more taken for granted than anything else
Yes, yes.
until
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 you
it is
lose it.
taken away from you.
Yeah, and I've used this example before. I want to be careful how I say this, but I just did a 3-month my internship in spinal cord rehab, and that's where people, have a variety of different kinds of injuries can happen to the spinal cord. You can have a lower, very lower thoracic one where you are completely paralyzed from the lower waist, like below the belly button down, and you relearn how to do everything and be completely independent, go back to your job, and then there's higher cervical ones where they have to have, assistance with breathing and a mouth operated power wheelchair, stuff like that. But one of the things that really struck me is we had one patient with central cord syndrome, which is where I hope I'm remembering the name of it right. I'm pretty sure it was central cord, where it wasn't a full spinal cord transection where it's like half your body is paralyzed or 3/4. It was that her legs were 100% fine. Her arms were flaccid. She lost, I don't think she lost everything. It was like she lost motor control, but still had sensation in her arms. And it was really interesting because in our society, being in a wheelchair is seen as like, that's the worst possible outcome. People will say that to me all the time. I just don't want to end up in a wheelchair. And I think it's helpful to question that assumption, because this particular patient, and I could imagine many others, found that the inability to use your hands was such a devastating effect on her daily life and her ability to function. She couldn't eat, she couldn't put her clothes on, she couldn't do, whereas the person who couldn't walk, as long as they were in their wheelchair and learned how, and again, I'm not saying that being in a wheelchair from a lower level, spinal cord injury is a picnic. It's totally devastating as well. But I think people in that situation, it's like someone might look at her and be like, oh my gosh, she's able to walk. Like she's not disabled, but actually she was very disabled from not being able to use her hands. So sorry.
Yeah, no, you're right. It's always perspective. It's always perspective. When we lose our legs, we're like, this is the worst thing ever. When your back hurts and you cannot even roll, breathe, or, pee, right? It's the worst thing that can happen to you. No one with a hand injury, like a severe one, or even someone with both hand injuries would ever say that that's worse, because they now have a new perspective. Right. So I think it's just perspective. I worked with someone, she actually came to me from the UK, a couple of visits, because she had a very particular type of nerve, spinal injury due to an infection, and it messed up her arms, her legs, everything. But she was getting a lot of her legs back, but her arms, she didn't have a lot of control, she didn't have strength, she didn't have coordination, and she is an artist. And she couldn't draw the way she used to draw, because she used to do little mini, like micro types of sketching, needed fine-tuned movements and stuff like that. And it is not until something happens to you. I mean, I treat it all the time. So I see it all the time. So it's always my perspective, which is to say that when you lose your hands, you lose function. I'm working with a young woman right now, rheumatoid arthritis. She's experiencing the problems in the hands. She did the therapy that she was supposed to do, but she wasn't getting results. So that's the other thing. Outside of getting early treatment, just because you don't have the luxury to wait, is finding a trusted therapist, even if it requires you to look around, even if it requires you to maybe consider paying for someone out of pocket, out of insurance. Because if you're not getting the results, you should recognize that really quickly and look for another one. Because when you find a trusted therapist in your area, then you can go back to them time and time again. Young woman, she came in, her elbow, she had a flare up in her elbow. the most recent one in her elbow and in her big knuckles. And once we started working with it, I asked her if she wanted help in the other parts of her arms that I was noticing had issues. And I didn't want her to, necessarily ignore that or think that I couldn't help her with it, because she has shoulder issues and they're all related. If your elbow does not work well, you cannot turn your palm up and down, right? If your elbow does not work well, you cannot turn your palm up and down. And the act of turning your palms up and down have an effect on how your wrist moves. And how your hands move have a direct effect on how your wrist moves. So everything is connected. And your shoulders, well, we can talk about those things for days.
Yeah.
But, if I'm talking to your audience, your people who listen to you, who have rheumatoid arthritis, who have any form of arthritis, when you have the pain, when you have the continuous pain, when you have the continuous limitations, find a trusted therapist. And the third thing is, something is always possible, right? Something is always possible. It may not be perfect, because sometimes, let's face it, when you have rheumatoid arthritis, sometimes the changes in certain joints are permanent, right? Recognize which ones are permanent and know which ones are possible to get back and to strengthen around.
Yeah, I call that like the solvable problems versus the unsolvable.
That's
like
right.
in the unsolvable ones doesn't mean that like therefore you give up. It just means that, okay, I'm not gonna remediate the underlying problem. How can we work around it? Can we use an assistive technology device or a gadget,